Hi, everyone. I'm Gwen Smith, editor and content chief of Allergic Living, and I'm delighted to be joined today by Dr. Zachary Rubin. You all know him as the bow-tied allergist from Instagram and TikTok, and now he's got a brand new book out called All About Allergies. So we're going to talk all about allergies. Dr. Rubin, for us to dive in, you've said before that being on social media has actually made you a better allergist. Can you tell us why you think that?
Oh, I know that because it has taught me how to listen to patients better, to come up with information that people have been wondering about. I get tons of questions online every day about what's going on. And it expands my knowledge because I don't know everything. Nobody knows everything. And it gives me an opportunity to look things up that may not have come across in clinics. And when I create content, it helps me take all the complicated information and try to distill it down to what people need to know in easily understandable terms. So I have had a lot of practice, not just in clinic, but online, creating educational content that I then translate into my office. And at this point, having been on social media for over 6 years, a lot of my patients find me from social media and they already know who I am. So when I meet them for the first time, we've already established a rapport, a type of relationship where already we've built it on trust because I make it a point that when I create content that it's evidence-based, nuance, and cuts through the fear and misinformation.
That's amazing. Now, and I can't believe that, 6 years already.
Yeah.
That's terrific. Now, tell us the book itself, all about allergies, and it really is all about allergies. You cover the full gamut. Subtitled Everything You Need to Know About Asthma, Food Allergies, Hay Fever, and More. Um, what? It's already a bestseller, but books are a lot of work. I know this. What inspired you to write an actual book about allergies as opposed to just being, the online guru?
Well, for a long time, I had thought about it briefly here and there that maybe I would write something because I had created so much educational information. I kept getting asked, well, what about this topic? What about that topic? And I covered most things after a couple of years, most of the topics that people were interested in. And one day I got a message in my office from one of the editors for an imprint from Penguin Random House who said that she and her daughter were dealing with various allergic issues and felt that my platform would help create a book that would help people learn about allergic diseases. And she got me connected with Park Fine and Brower's literary agency, who then helped me write a proposal. And then that got taken up by Plume, which is an imprint of Penguin Random House, and the team there has been amazing. They've helped me along the way with this process that I spent close to a year writing the book, but just as much time also promoting the book and explaining to people why this resource matters and how we can change the way we talk about allergic diseases. Because, as we all know who are listening, allergies, especially food allergies and asthma, often are the butt of a lot of jokes. And that is stemming from the fact that people just don't understand the nuance and the way that these diseases can impact people. It's not just a minor nuisance, but it can be a potentially life threatening situation. It can increase the risk of secondary issues like psychiatric disorders of anxiety and depression, as an example. And when we see in front of us that these are not taken seriously, that it's joked about a lot, it makes it harder for people to get taken seriously and to enjoy their lives when everybody should be able to do that.
Yeah, it is so ridiculous that people do make fun of these diseases because I mean, it's not like anybody walks around and chooses to have a food allergy or to have breathing difficulty with asthma. It is kind of crazy. Now, you yourself, you mentioned in the book, outgrew a milk allergy and you had eczema as a kid. How did those experiences inform your interest as well in this area, in just even going into being an allergist?
Right. So it wasn't a major influence on my choice to become an allergist. It was something that I had dealt with. Not too many memories of the food allergy portion because I outgrew it pretty young, but the eczema piece I still have some minor issues here and there, but I remember the severity of it as a child and not being able to wear jeans like other kids were and
Mm.
trying to cover up as much as possible because people thought it was like cooties, something very, very strange that they just didn't understand, especially if it was on my face. And it was very itchy. And when people don't experience itch, they don't really understand how much it can just make it very difficult to concentrate, to sleep, to have the energy to do things. It was very challenging for me as a kid, and I was fortunate that most of it has resolved. But I have taken that with me to help empathize with my patients and connect with them on a different level, because oftentimes patients and their families feel like they're dismissed by certain medical professionals. Some of that is just the systems issue, which is we don't always have enough time with patients to go through everything. And there's an element of it where there's an empathy issue. And so it does help me connect with patients a little bit better. But it didn't have a major influence on my choice to become an allergist. That came from experiencing the field firsthand as a medical student and as a resident, where I saw this field exploding with new information, with the ability to take care of all ages, and really, as a specialist, doing a lot of preventive medicine to try to help prevent people from going into the hospital, improving their quality of life, and making people feel better every single day was something that I've always strived to do, especially with my early experiences in medical school, where I saw a lot of tragic events, a lot of children passing away or getting very sick, families losing loved ones, and I really wanted to do something where I could help keep people out of the hospital and improve their quality of life.
Well, that's excellent. Well, we're definitely very glad that you chose the area of allergy because it needs a lot of support by caring and compassionate doctors. It really does. Now, I mentioned that you cover the full range of allergies in this book. You know, you've got everything from obviously food allergies and asthma, right through pollen, pets. You even get into mast cell disorders, which is quite interesting. But what fascinated me near the start was when you got into describing the immune system. And you do it in a way that is it's very user friendly for the person who's really uninitiated. And I think in this community, a lot of people they really want to know what drives my child's or my own food allergy. You know, for instance, you know, I think our biggest community here today will be the food allergy community. And people really you know, they want to know how those mechanisms work, but it is complex stuff. You know, I've had the experience of having to boil it down myself into everyday language, you know, trying to get to how IgE emerges. You know, it
Right.
really is quite complicated. Why was it important to you, I guess is my question, to include that for patients and parents?
It's such a great question because the book has been well received overall, but I do get some feedback constructively saying this is a little too academic or technical at times. And the reason why I put that in there in terms of chapters related to the history of allergy, the immune system, the anatomy of allergies, as I call it, I put that in there because whenever you're learning a subject, you need to have the foundational knowledge, that language, to be able to have a better understanding of the diseases. This is what we do in medical school. You have to learn the normal and the abnormal, so to speak. And a lot of people, as you say, are asking, why is this happening? And when we give you that information in as understandable of a way as possible, you then can have a little bit more deeper discussions with your doctor about some of these issues and then have a greater appreciation for the fact that we know a lot, but there's a lot left to be desired that we just don't fully understand. But we've made huge strides. That's why I put the history of allergy in there to show you how much we had no idea of what was going on, yet we had inklings of it since antiquity, and it's always existed. It's not like it was just randomly popping up in the 20th century, but it's always been there since recorded history. And we're just now, over the past 100 years, really getting a better foundational understanding of this. And it is continually changing and growing to the fact that when we end the book talking about future directions in the research that's out there, many of the things have changed from the time that I finished writing the manuscript for this book and what's happening now. It's just happening at lightning speed now.
And absolutely. I mean, when you talk about the fact that we've got um, biologics coming in food allergy and asthma, and they were first out in eczema. This has been, a sea change in terms of people talking about treatments as opposed to just always saying, how do I avoid, how do I live with? So it
Right.
really has been a huge change, really, in the case of food allergy, just in the past few years.
Right. And
And
just our understanding of diseases in general, asthma is not one disease. We
yeah,
know there's multiple molecular mechanisms, and because of that, we have tailored treatments now, and there's a lot more than in the past 20 to 30 years.
yeah. Now, one of the things where there's a lot of confusion is food allergy testing. We often hear from people, I think my child has a food allergy, so I want to go test. And maybe you have had an experience as a parent where the child seems to be having significant symptoms to one particular food, be it milk or peanut or something along those lines. So you go to the doctor, and what do they say to you? They say, "Can you test and see if there's anything else?" What's the problem with that? Because I think a lot of people still don't understand this.
If we were to do a panel of foods where we're checking for the IgE antibody levels that could specifically bind to 20, 30, 40, 50 foods, there are a lot of tests that will end up being falsely positive. It'll say you have the antibody, but that doesn't necessarily mean the antibody reacts. So the adage that I was taught is that sensitization does not mean allergy. Or, in other words, positive IgE testing, whether it's skin or blood testing, does not clinically mean disease. You can have a situation where if you do this in a young child and they have a positive test and you start worrying about it and you avoid the food unnecessarily, that delayed regular exposure could increase the risk of truly developing a food allergy that could be potentially lifelong and potentially life threatening and have a whole host of issues that people who live with food allergies can tell you a lot more about what they have to deal with day in and day out. And so, my role, now knowing that the science and our understanding of this has changed, is to have a megaphone and tell people, unless there's a very specific reason that needs to be done where the evidence of the benefits outweighing the risks, I do not recommend doing panel food testing for most of my patients.
Well, they may come away. I mean, as somebody who has three severe food allergies to peanuts, soy, and shellfish, I'm telling you, I wouldn't want to, be in a situation where you're avoiding extra foods that you don't need to. And it can even start to affect nutrition for some children, right?
Exactly. It can affect
So,
nutrition, feeding difficulties, can cause extra anxiety, stress, some social issues, right? If it's for school or parties, there's so many issues that people with food allergies face that my goal, and I tell this to my patients, my goal is not to give you more problems when you walk out of the door. My goal is to clarify what is going on and empower you with the information so that you could better appreciate what you know and what you don't know and live a happier and healthier lifestyle, minimizing the potential fear that goes along the way. Because if you have to have all these different allergies, you then have to change all the decision making related to reading food labels, communicating with people, etc.
I have to stand back to say you do have such a crazy big following online now. You're over 1 million on Instagram, 2.2 million on TikTok, which is like, wow, that's a city. What do you think has brought so many people your way? What is it in what you're doing?
I think there's a couple of things. One is the fact that I stand by my belief that evidence based medicine is nuanced and complicated, and we cannot go about what I see other people doing where they're trying to sell something and be very confident, demonizing single ingredients or just misconstruing information. And I try to educate people in as an approachable and understanding way as possible. So if it's in terms of the cadence, the rhythm of how I talk, how I try to put analogies and give you the detail that is as simplified as possible. It could also be the fact that I am comfortable with who I am as a person and I can be goofy at times, I can be serious at times. I hula hoop, I wear my bow tie. I've got the stereotypical nerd look, but I wear it proudly. It's who I am, and I speak out against injustices in the world, especially when it comes to issues related to public health, misinformation being spread online, and clarifying what people have a hard time understanding when they see other people going through these, where I showcase, hey, this is what hives look like. It can be induced by cold temperatures, it can be induced by food, all these different issues, and I will go through and talk about it multiple times in different ways to give as many people that information as possible. And I will look at the trends of what people are doing online and kind of hop on it in fun ways. Um, I have this balance where I'm just trying to educate people and meet people where they're at and break down barriers.
And I wonder, do you get a lot of patients from referrals from doing this work, or do you have to turn people away?
I do get a lot of referrals. I've had people drive or fly to see me. I had a family come from Colorado fly into the Chicagoland area and give me a hula hoop and ask for a second opinion. And people drive for hours sometimes to see me. And it's a humbling experience where the power of social media is you can get information out to way more people than you would ever see in an office. And I've talked, and you've been to some of my talks where I discuss this and encourage people to tell their story because as a physician, you may see as a specialist, you know, 20 to 40 patients in a day, depending on how your practice is structured. But I could spend 5 minutes talking about a topic and I can reach tens of thousands of people in an hour, and when you do that over and over again, people get to know you. They get to know what you stand for. And so I've had a lot of people say that I felt like I learned more from what you have done online than my own personal doctors. And I think there's a little bit of an element of a critique on the healthcare system because, again, we just don't have enough time with our patients. And to be able to give that additional time to people, to give them that insight, it is so invaluable. And the biggest take home point for me personally that I'm just so honored and humbled by is that people trust me, that they've developed this trust even if they haven't physically met me. And so when I see these new patients who have followed me for however long it's been, it's such a surreal experience where the conversations just flow so much more easily. And when I talk about, hey, we should avoid this type of testing, or here's the risks and benefits of these different options that you have, it's such a pleasant conversation, and I feel like it's much more productive because of that trust that's already earned before they come in the door.
Okay. You know, one of the longtime issues that we've covered in the food allergy community at Allergic Living is just the reluctance of people, the hesitation. We actually called it the epidemic of hesitation at one point to use epinephrine when it's needed. Do you have any insight into we know it's the first line, medication if you're in a reaction that's progressing. Do you have any insight into why this avoidance that people have?
There's several potential reasons for that. One is a financial reason, unfortunately, which is we've been people have been ingrained into saying, hey, if I use epinephrine, I have to go to the emergency room. Well, one, epinephrine is very expensive in many parts of the world, like in the United States. Two, emergency room visit fees can be very expensive. And three, people are worried that, oh, if I use this medication, it's a big misconception. They think that they're dying if they use the medication itself. So there's a lot of misconceptions about anaphylaxis and the management of it. And the current guidelines are starting to move away from universal activation of EMS, of going to the emergency room. And you can start having more nuanced conversations and have a lot more education about, do you in every single situation have to go to the emergency room? And that's not always the case, that we don't necessarily prevent biphasic anaphylaxis, having a secondary reaction by going to the emergency room. There's not really much evidence that systemic steroids prevent biphasic or a late phase anaphylactic episode after the first reaction has ended, as an example. So a lot of people I hear will say, if I use epinephrine, I go to the emergency room because of the epinephrine. And that's not even why we recommend it. People are scared of needles as well.
Hmm.
It's a big needle phobia.
Fortunately, we are getting that we at least have the other option now of the epinephrine spray in the US. Yeah.
exactly. Yeah, in the U.S., Neffy is there, and there's also going to be potentially a sublingual strip called
Possibly, yeah.
Anafilm. We may be getting something like that too, which will help decrease some of that worry. Uh, but I always feel that a lot of the fear that comes out of these issues related to allergic diseases is knowledge. That people are second guessing, is this truly anaphylaxis or not? And I try to train my patients, especially the parents, they have young kids. You're a good parent, you're a good mom, you're a good dad. You will have a gut instinct that will tell you something's not right. Listen to your gut instinct before you even look at your allergy action plan. If you think you should be using it, you shouldn't be calling me, you should use it. Then let's look at the list. And we go over point by point the signs of anaphylaxis and why it's so important to give epinephrine right away, which is that if you delay it and there truly is anaphylaxis, you have risks of having severe anaphylaxis not as responsive to epinephrine, higher risks of staying in the hospital, in the ICU, potentially life-threatening situations that can come of anaphylactic shock. And also the language of the difference between anaphylaxis and anaphylactic shock. They're different. And people need to understand how those terms mean different things. And you hear people throwing around, I was in anaphylactic shock. You weren't necessarily in shock. So it's important that we have the tools and the knowledge so that we can live with less fear. When you have that knowledge, it's easier to manage.
We're sitting here in early spring. What do you want to say about allergic rhinitis? Because so many people suffer with it. I think that you talk about it I might say, this excellent book, All About Allergies. Just the fact that, I think it, like other allergies, has sort of this reputation of, oh, you get a few sneezes, etc. But it can be a lot more life-altering than that. Do you want to just say something about that and what we can do with spring landing here?
Absolutely. So first, it's nothing to sneeze at. I always love saying that.
Yeah.
But it really, truly can significantly impact somebody's quality of life, where you have a hard time concentrating, you have a hard time breathing through your nose, making sleep quality decrease. And so sleep is so important for people's health. And I talk about it in the book, but in Japan, it's so bad there during their spring season that many companies pay their employees to move away and go somewhere temporarily where there's less pollen and they can work better. It's an
I
economic
saw that.
problem.
That's incredible.
It,
Yeah.
it, it is a big economic problem,
Yeah.
and uncontrolled allergies also increase the risk of infections like ear infections and sinus infections, and needing antibiotics, which we know is a public health issue that we should not be overusing antibiotics, but yet you would need it if your sinuses are closed off and you get bacterial overgrowth, as an example. And so I always encourage patients to get tested to figure out what you're actually allergic to see what ways you can reduce exposure to those allergens, what are the proper medications to take and what time of the year, and if immunotherapy or injections is something that would help treat that underlying process. So that's the three-tiered approach that I discuss in more detail in the book.
Dr. Rubin, I want to thank you personally for all that you do. As a communicator, I can't say enough about what you do to, improve the lives of people living with serious allergies. So that's excellent. And again, I hope everybody does. This is a terrific book. You cover a lot of ground, and I hope everybody gets it and keps that bestseller going
Thank you
right up
so
the
much.
charts.
Yeah, it's
Yeah,
amazing. A
Doc,
New York Times best-selling book, as About
amazing.
Allergies. It just is changing the way we talk about this.
Yeah, that which is great. It's terrific awareness and wonderful accolade for you personally. Dr. Rubin, thank you so much.
Thank you for having me.